to get an epidural or not to get an epidural? That is usually one of the biggest questions when you're pregnant. I know that I was constantly fielding that question when I was pregnant with my son, and I really did not have an answer for anybody until I did more research, talked to my care provider, and made a choice that worked well for me. So today I'm going to be helping you look at the pros and the cons of an epidural to help you make a more educated decision. And the thing with an epidural is there is absolutely no right or wrong answer. For some women, an epidural is an excellent choice. For others, it's not. So just know that there is no shame, no judgment in any of your choices. You have every right to make this choice for yourself. But again, having all of the information makes that decision a lot easier. So here we go. All right, so first and foremost, what is an epidural? We hear the term thrown around a lot, but a lot of us don't really understand the mechanics of it. So obviously it is one of the most common forms of pain relief during childbirth. It is a local anesthetic that blocks nerve impulses from the lower spinal segments, and it creates numbness from the waist down. Before it's administered, a mom is typically given 1 to 2 liters of IV fluids. Then an anesthesiologist will numb the injection site in the lower portion of the spinal cord, and then they'll administer a really small catheter that's attached to a needle. And so after that is administered, the needle is removed, the catheter remains, and it delivers medications through an IV pump or occasional injections of the medication. And these medications usually are a combination of numbing agents and opioids. After that epidural is placed, some women don't feel anything at all, and some just feel a bit of pressure during contractions. So that is the standard epidural, but there's also something that is called a walking epidural, and this is much less common. This is also called a combined spinal epidural, and this is a type of epidural that allows for more movement during childbirth because it has a lower dose of medications. While women can't actually walk around with a walking epidural, they can get into a variety of positions. For example, as a birth doula, I attended a birth with a mom that had a walking epidural, and she was actually able to use a squat bar on her hospital bed to squat while she was pushing. And she really enjoyed it because she was, for the most part, numb, but could still feel enough to get into that position. It was a really happy medium for her. A lot of hospitals do not offer the walking epidural, so this is something really good to start talking to your care provider about now, because maybe it is something they could provide if they know you want it. Okay, benefits of an epidural. So about 60% of women in the United States get an epidural, so there must be something to it. Some of the benefits: it promotes rest. So an epidural helps to remove one of the primary blocks to a healthy, happy birth experience: fatigue. So for some moms, especially first-time moms, labor might be incredibly prolonged, meaning that the mom might just completely run out of steam. And with an epidural, the contractions can essentially not go away, but the sensations of the contractions usually go away enough so she can actually sleep, something that is very difficult to do when you are in active labor and having pretty strong contractions every few minutes. So that can be a big benefit. As a birth doula, extreme fatigue is one of the main reasons I've seen women get epidurals, and for them it was incredibly effective. All right, minimizes anxiety. So as contractions intensify, some women experience a lot of anxiety. Some women go into the fight, flight freeze response. This means that blood is redirected to defense organs. The uterus is not a defense organ, so it can create some complications if the mom really starts to freak out. And while a lot of childbirth preparation classes provide a lot of incredibly effective tools to relax, through breathing, through visualization, sometimes that's not enough. And getting the epidural might help to minimize or completely eradicate that anxiety. Another benefit of an epidural is that it allows for more alertness than other pain relieving medications. For example, another option would be to get an injection of an opioid, which would go straight into the bloodstream, and that often leads to mom being really drowsy, really loopy, and often it doesn't completely eradicate the discomfort of the contraction. So the mom is still trying to manage that pain while being really out of it. And another positive is that an epidural minimizes the amount of medication that actually reaches the baby. Okay, so risks of an epidural. While it does have many benefits, it's also composed of really strong medications that come with potential side effects. One of those is a drop in blood pressure. Because of this, mom and baby will be continuously monitored during an epidural. When you have an epidural, you will always be hooked up to the monitors. In some cases, a mom gets a spinal headache from the epidural. This is a really intense headache that often requires some intervention, but again, it's pretty rare. Okay, difficulty pushing. So depending on the strength of the epidural, a woman might not be able to connect with the uterus enough to effectively push. This is not always the case. I've seen plenty of moms give birth vaginally with an epidural, but I've also seen plenty of moms have difficulty. Okay, other side effects, potential side effects include shivering, fever, and itchiness. So an important component of deciding whether or not you want an epidural or you want to try for an unmedicated birth is continuing to educate yourself. And a great way to do that is by taking a childbirth preparation class. In this class, you will learn more about birth, the mechanics of it. You will learn about different pain relieving tools, natural pain relieving tools like breathing, different positions, visualization. I think it's really great to take at least one class like that so you can really know what your options are. So some of my favorite childbirth preparation methods include hypnobirthing, Lamaze, and the Bradley method. I would recommend researching each or any other ones you've heard of. Birthing from Within is another great one, and selecting the one that resonates most with you. And before making your final decision, I would definitely recommend checking in with your care provider. If you have any special circumstances that might play a part in whether or not you have an epidural, those are just a few considerations to keep in mind. Wishing you a happy and healthy birth experience.